Now we're going to talk about something very interesting when it comes to stem cell therapy. Soft tissue injury, muscular related problems, ligament tears, osteoarthritis, degeneration of the cartilage. These are things that I'm sure each and every one of you would be hearing on a daily basis. Almost all of us at some point of life may develop problems related to soft tissue. We're talking about people from all over the world, sportsmen, athletes, people who are doing vigorous activities, hiking, climbing. There is no way that we can escape soft tissue injury. All this while, problems like osteoarthritis, for instance, when it comes to osteoarthritis of the knee, at one point, the only option that you may have would be surgery. Until today, stem cell therapy has shown to be very, very effective when it comes to treating soft tissue injuries. Let me elaborate. Countries like Korea, for instance, have gone to clinical phase 2. Now, what clinical phase 2 means is that they have taken research and they are currently doing it on human trials. So this means that whatever they have done is definitely safe and definitely effective for you to actually attain clinical phase 2. Now, they have gone to clinical phase 2 for osteoarthritis of the knee using umbilical mesenchymal stem cells with a combination of hyaluronic acid, which is amazing, and the results that they have obtained using this therapy is spectacular. We have seen cartilage regenerating in the knees and tremendous reduction of your symptoms, your pain, your discomfort, the limitation of movement significantly reduced in patients who have undergone stem cell therapy on the knee. Besides, we have also had patients with ligament tears, partial tears of the anterior cruciate ligament, which is very common, for instance, and using a focused or a directed stem cell therapy into the ligament area, we are able to actually stimulate recovery of the ligament. Now, stem cells has the ability to do it. Besides, if you're talking about muscular injuries, now muscular injuries can come in many forms. Some can be pull, they can be tears, they can be due to trauma, that means if you have like a crush injury, and muscular related injuries also, the recovery can be enhanced using stem cell therapy. Not only that, when we are talking about wound repair, when we are talking about wound regeneration, stem cells has the ability to hasten the entire process by a significant amount of time. You're talking about closing wounds in months rather than years. You're talking about closing wounds that have not been able to close because of other problems like diabetes, for instance, using targeted stem cell therapy. Now, this is a field or a part of medicine which really has improved a lot using stem cell technology. Now, when it comes to osteoarthritis, we usually perform direct injections, be it osteoarthritis of the knee or osteoarthritis of the shoulder, and these direct injections will contain umbilical stem cells. And what happens when we do the procedure is the stem cells, once it enters into the capsule or the space, will trigger an inflammatory response. Now, you must always remember, inflammation is not always bad. Inflammation is basically the way our body defends itself. So when you have an injury, you have inflammation, and then you have recovery. Stem cells will induce inflammation in that particular area in order to trigger a recovery response. Now, that inflammation would probably give you a bit of pain and discomfort for a few days. But once the inflammation subsides, then the stem cells will change into cartilage cells, they will change into ligament cells, therefore correcting the problems in that particular joint space. We have got evidence using X-rays, we have got evidence using MRIs that shows we can obtain recovery using direct injection of mesenchymal umbilical stem cells. At the same time, when we are talking about wounds, we have enough evidence and we have good results using direct injection of umbilical cells. And some of the wounds are exposed, whereby the tendons, the ligaments are also exposed, and even those can be rectified using stem cell therapy. So my personal experience when it comes to treating soft tissue injuries using umbilical stem cells includes some extreme sportsmen. So I've had this extreme sportsman who came from America, and he had partial ligament tear on his left knee, as well as a grade 3 osteoarthritis. So osteoarthritis is basically categorized into 4 grades, and grade 3 is considered pretty bad. Grade 4 is when you don't have any other options besides surgery. So he came in and we administered stem cells into the knee. After the first session, he had about 20 to 30% of improvement, but it was not good enough for him to continue his activities, which included surfing, mountain biking, extreme sports. So he came in for a second session, and we injected stem cells into the knee capsule as well as towards the ligament injury. And it has been a good 6 months after his procedure. He is surfing, he is hiking mountains, he is doing mountain biking, he is living the life which he has always had, despite having a very major injury to his knee. So that was the recovery which we were able to obtain using stem cell therapy. Now we have his MRI results, which also showed that the ligament regenerated and his osteoarthritis has reduced significantly as well. Let me talk a little bit about the options that people with osteoarthritis have. Now, osteoarthritis is one of the major concerns in the whole world. The options that most people are given is, of course, you start off with a little bit of physiotherapy and light exercises. You end up being given supplements like glucosamine, or you're given supplements like turmeric or antioxidants to reduce the inflammation in the knee. Some people are given anti-inflammatories or painkillers to manage the pain and the discomfort, which also, if consumed for a long period, can be harmful for the body. Besides that, there are injections, steroid injections that can be done to reduce inflammation, but this is a temporary relief. Eventually the inflammation will build up again because cartilage degeneration is progressive as we use, which we have to use our knees. As we use our knees, eventually the degeneration will continue. Besides, there is also temporary solutions like hyaluronic acid injection, just to give you an artificial cartilage to help ease the discomfort for a certain time. And of course, if things get really bad, then the final solution would be surgery. Surgery would mean that they will insert metals into your knee to keep the bones apart. These are the traditional or the typical methods that have been used to treat osteoarthritis of the knee until today. But with stem cells, we are able to obtain recovery with no medication and no surgery. So it is definitely a more preferred option, and many countries are looking into fine-tuning this procedure so we can achieve the best results with the least amount of time